What is HPV? A lot of people have heard about HPV, and it may be scary to have your doctor tell you that you came back positive for HPV on a pap smear. But let me try to explain a little bit more about HPV and hopefully allay some of those concerns. HPV is technically a sexually transmitted virus, but it's kind of different from other sexually transmitted infections in that it's so common. So pretty much everyone who's sexually active is going to be exposed to HPV at some point in their life. And most of the time people are exposed to it, they have it in their body for up to 1 to 3 years, and then their body usually fights it off and it goes away. We don't even recommend testing for HPV until age 30 because we just know that people in their 20s likely may have HPV for a few years here and there and comes and goes. Starting in around age 30, we will routinely check for HPV with a pap smear. And the reason why we check for HPV is because if the body does not clear HPV over several years, it can gradually start to lead to changes in the cells on the outside of the cervix. And we first see very mild changes, and then gradually over about 10 years, if we don't do anything with these changes, they can progress to higher grade, more significant changes, and then eventually progress to cervical cancer. So that is why we check for HPV and why we recommend the HPV vaccine for everyone. It's approved now up until age 45 to get the HPV vaccine to help prevent cervical cancer. Because the body is able to clear HPV so well on its own, typically we don't need to treat any kind of positive HPV test or even mild abnormal pap smear. We just monitor it closely. So if somebody's had HPV on a couple pap smears in a row, we may then recommend something called a colposcopy, which is a procedure in the office where we take small biopsies of the cervix, look under the microscope, just make sure we're not missing any of those higher grade changes. If somebody does eventually have these changes progress to high grade changes, then we would recommend a procedure called a LEEP procedure where we take off just the very outer layer of the cervix. But the good news is that means that these changes are very treatable. So even if they do progress to the high grade changes, they're very treatable with this procedure before they progress to the point of being cervical cancer. But the vast majority of the time, they don't even get to that point. There may be some mild changes, and then over time, the body usually is able to fight off the HPV virus, and those cells go back to normal. And then once someone's had a couple normal pap smears in a row, they may be able to just go back to routine screening paps with HPV tests about every 3 years. I hope this reassures some people about HPV that it's very common, and usually it's not a big deal. It may just mean that we need to do pap smears a little bit more often until the body's cleared the HPV infection.